Not Angus, not Bon Scott. I'm Alex Fair. Just some guy who really likes startups. So we've been doing this for a while. And what we've been doing is we've been accelerating crowd-validated companies. We started out with a community doing contests, and then we did crowdfunding. We created a website called MedStartr.com, and we started running contests. And we noticed that when teams were validated by large crowds of people, they'd be much more likely to be successful. So we got a great show for you today. So I'm going to tell you a little bit about what we're doing. First, obviously, welcome. Welcome to ACVC. The very first time we've done this show, Highway to Health. And we love, obviously the double entendre, but it's also an important thing, right? Because if you look at that graphic, that is what happens, right? It is difficult. And getting to the highway of the future is not easy. And a lot of startups don't make it. So we want to make sure as many make it as possible. That's why we've been doing events. This is our 223rd live event. We've done over 1,000, including online events. So we see people from our Clubhouse community here. Some of them work with us now. And so it's really been an amazing journey. But today we're doing the next thing. We're going to take 7 more companies, and we're going to do something a little different. Usually, somebody sponsors a contest, or we say we're going to go do some due diligence and maybe invest. This time, we already did the due diligence on these teams. They already are assured that they're amazing. We had 54 teams apply just in the last week, and we were really impressed with them. And so we selected from them and another 300 teams that we reviewed, and these are the best, and we're very excited about them. So this is the order of teams. They're going to get 3 minutes to pitch, and then we're going to get 4 minutes of Q&A from these esteemed judges. They're going to introduce themselves in a minute. We don't have a lot of time, actually, but I don't have a watch. Amy, is this 4:53 yet? Okay, so I can talk for another minute. Have I covered everything? My team is amazing. So a lot of these people are actually working with us being volunteers. So Paulo Machado, keeps me sane, sort of. And, he's the one who helps us produce these things. Omar Shaker, not just a physician, not just an amazing poet, but he is also coordinating this event. He's my producer. Dipti Bhatt over here is doing social media. Patrick Hurd made all of this stuff. Sharad Mishra ran my due diligence, a physician. He's been working with me for years. Robert DeLeonardis, not to be confused with Steve Will Do It, who's his nephew, if you guys know where he is, has been obviously doing production of this event and is my partner and also the 3rd investor in my fund, and still one of the biggest. Really fantastic guy. So I could not do this without you. Okay, so judges, you all have 2 mics in front of you. If you guys will take 30 seconds and introduce yourselves each, because everybody who's here is not the same group of people who were here before. So a lot of people already heard my versions. Let's hear their versions. Take it away, Amy.
Hi, I'm Amy Gleason.
Okay, I'm going to do my mic instructions, which I always do, which is you have to talk right into the mic.
Hi, I'm Amy Gleason. I'm with Russell Street Ventures. I'm the Chief Product Officer. Before that, I was at the U.S. Digital Service at the White House, and I had a startup before that helped patients with chronic diseases.
Okay, so how many people heard Amy? You guys all heard her. Okay, great. Thanks. I'm glad that I'm wrong. Great job, Amy.
Check. Can you hear this? Yeah. Hey, I'm Nick. Pink Socks Life. Happy, smiley people all around the world, just like you. So it's good to see you.
I don't know how to compete with that. Hi, I'm Sharice Maynard. I've been called the Simon Cowell of judging, but I believe that being truthful with startups is how we all move forward, and we all have to hope that all of you succeed, no matter what.
Paulo Machado. I basically advise and invest early stage companies.
Hi, Aline Noizet to have Connector. I'm based in Europe, work with startups over there, and I'm also associated with MedStartr.
Kat Jong, MD, practicing psychiatrist, former MedStartr intern, and now help out with due diligence and helping consult for different startups, including Valera.
Eugene Berhovich. I'm either a recovering executive or a recovering entrepreneur, but always recovering. And I joined my wife in building YourCoach.Health after leaving a big company.
John Hui, CEO of Triage and healthcare entrepreneur and angel investor.
Ashish Patel, a co-founder of CareSet Systems. And before it was CareSet, it was called DocRaf, and we crowdfunded our solution about 10 years ago on MedStartr. So happy to be here. Thanks.
Okay, so clearly I don't remember how we set up the deck, so sorry about that. So if you notice that some of them weren't on the slide, it's because they are MedStartr portfolio companies. So if you work for a MedStartr portfolio company, raise your hand. That'd be Eugene, Triage. Okay, yes, Valera, Triage, and York. We're very proud of how well those companies have done. So we talked a little bit about this before. Yeah, we're in this for the right reasons, but we realized a long time ago that if you crowd test before you invest, it works a lot better. So it's been working pretty well. But our community who actually ask isn't just venture capitalists, isn't just hospital leaders, it's patients. So if you notice, you've got many walking gallery members here, right? So you got Fred Trotter over there, who works with Ashish, Amy Gleason, myself, Paulo. These are all patient activists, right? Nick Adkins. We listen to people who listen to patients, and a lot of us are patients. Care providers, you got physicians like Kat Jong. You got people who work in hospitals and organizations like Amy Gleason. And you've got people who work to big partners like Paulo Machado. And you guys are all those people. When we listen to you, we know that it's much more likely to be successful. Okay, so that's the part that I missed before. Sorry about that. We also do these events around the world. Well, around the United States, and now we started the red spots. We finally got out of the United States. We were going to go all over the place before COVID, and now we're going to go do it again. So if you're interested, we'll work with you on that. Okay, so I think that's enough about us, because it's not really about us. It's about the startups. So if we can bring up the first deck, and we get the timer going. So here's how it works. The teams get 3 minutes to pitch. They're going to hear a buzzer, and then they get 4 minutes of Q&A from the crowd. We're going to have a mic runner. If anybody raises their hand and we have time, we'll be happy to answer your questions. If you notice on the form, you can actually give comments to the teams. Does anybody need a pen? Because we got a lot of pens. If you need a pen, we'll run one out. So just raise your hand. Thank you. So Overcome is our first company. So Adam Hutchinson will come on up here. He's got a mic right up here. So, oh, look, applause. Okay, so here's how it's going to work. And the rest of you guys pay attention. So you guys get behind here. Thank you. That's a good idea. You have this here. You're going to have clicker. So this has 8 minutes on the clock. Actually, can you make that 7 minutes? 7 minutes. Okay. So once you get down to 3 minutes past, you're supposed to stop. He's going to ring a buzzer. And now, if you can, I usually let people talk a little bit, but it's going to come out of your Q&A time. Okay, so you want to just finish up real quick. So you can see it real time. You can see that. Judges, you can watch here, right? Okay, so those are the rules. You're going to be judged on this rubric right here. Okay, so just so you know what it is, it's the same thing. So you can read along. There's also a barcode here, so if you scan that, it will take you to an online judging forum, which makes our jobs a lot easier to do the math. So clinical benefit, right? How, is it going to be helpful to patients? Okay, is it going to work? Feasibility, 1 to 10. Innovativeness, have you never seen this before? Okay, fundability, if it's your money, would you give it to them? Okay, is this possible to go global? Scalability. And then general presentation quality, right? I mean, that you can fix, so it's not really the biggest metric. And then you can rank it, and you give notes to the team. Now, you could make it private, or you can share it with them. On the back, if you guys want to partner, try, do anything more, that's where you guys write that. That's like double jeopardy. That's where the scores really change. Okay, so you guys do that, they get Bondo points, especially if we credential you and it's real, okay? So, anyway, so that's how it works. And you can play the home game if you're watching at home. You can click on that link underneath the MedStartr.tv video, and you can be part of the scoring. So, please enjoy. So, not just silly music and Alex's silly getup today. there's going to be some amazing companies. So if we're ready, as soon as you start talking, that timer is going to go down. I will get out of your way. This is your clicker. Okay. The green button means go. The red button means go back. Okay.
Cool.
Take it away.
Hi everybody, thanks very much. My name's Adam Hutchinson. Now when I was 16, I was incredibly shy and insular. So bad so that I quit school to go and work on a farm just to avoid social situations altogether. I was diagnosed with social anxiety, which is one of many anxiety disorders that requires treatment in order to overcome it. I wasn't alone. 18.1% of the world's population have an anxiety disorder like I had. There's probably 15 people listening to this now that suffer. If not you, you know someone that does, that suffers from a fear of flying, a fear of spiders, a fear of needles. 80% of us receive no treatment whatsoever, and this is what's commonly referred to as the treatment gap. Now, anxiety disorders don't just go away on their own. In fact, left alone, there's some pretty significant consequences downstream. You have a higher chance of developing something more serious like alcoholism, drug use, and even suicide, which comes at an economic cost to the US economy of $68,500 US per case per year. If I go to my psychologist, I'm going to do what's called exposure therapy. This is the gradual exposure to what it is that I'm avoiding. It's the gold standard and works in 90% of cases. The question that I have in my mind is, if there's an effective treatment, then why is there a treatment gap? There are 4 reasons. 1, it's expensive, hard to access due to location. There's a stigma and a lack of trained psychologists. So in March 2020, I decided to solve this. How can we make treatment for anxiety disorders easier to access? I couldn't answer this alone. I put together a team of the best clinical psychologists from around the world, engineers from my previous startup, which I just exited, that said no to Google to come and work on this challenge with me, and the best business advisors out there, like Marcus Osborne, former previous Senior Vice President of Walmart Health. And in February 2021, we released Overcome, a direct-to-consumer smartphone app that provides virtual reality exposure therapy to children and adults with anxiety disorders. It's clinically safe, it's clinically proven, and it's extremely, extremely scalable. Here's how it works. Someone downloads Overcome to their smartphone. They go through 2.5 hours of psychoeducation. At that time, the Overcome headset has arrived in the mail. They put their smartphone into it. They start their virtual reality exposure therapy at home. If they are seeing a psychologist, that psychologist can connect in via a telehealth dashboard into the VR session in real time. Throughout this whole experience, we're capturing data, including physiological data that helps us personalize the treatment at scale for this individual. Not only that, it's actually better than in vivo virtual exposure therapy because through technology, they can do more of it. So let's go back to those 4 reasons. In terms of it being expensive, Overcome is $59 US for 6 weeks of treatment with an optional $17 per month subscription. In terms of location, through our integration with DHL, we can ship anywhere around the world. In terms of stigma, it's done in the privacy of their own home. In terms of lack of psychologists, it's built by psychologists and built to scale. And scale is what we need to solve the treatment gap. There's 87 million people in the United States alone that have one of these disorders that do not get treatment. We're on the way already. We've sold to 30 countries. Our organic revenue is growing 30% per month. And does it work? Okay.
5 seconds.
We've done a clinical trial and there was a 75% reduction in severity. We've now got a pilot with the NHS in the UK. And we're using technology to make the treatment gap much smaller. And we're halfway through our seed round.
Adam, okay. So you used up 4 minutes there, almost 4 minutes.
Okay.
So we're going to give you back, 3 minutes and 11 seconds once I stop, okay? So this is not a good idea, okay, because their questions are very important.
Sure, yeah.
Okay, so I know 3 minutes is not easy.
Yeah.
Okay, so you're going to be allowed to do it. You're going to have to play over music, right? But don't do that. Okay. So I love what you're doing, and that was a great pitch. So judges, you've got about 3 minutes and 12 seconds to pepper him with really hard questions. Take turns, make them short. Let's get through it. Take it away.
So you're revenue positive already? You're revenue positive already?
No, we're investing in R&D right now, so we're getting further into...
okay, so those are...
Yep, that's organic growth.
Okay.
It's in our sales.
And the usage right now is coming from where?
It's about 40% of our sales right now are in the US. So we've had about 600 sales of our beta product, and 40% are in the US. The rest are everywhere around the world. That's all organic. We're not advertising at the moment. Those are people that have found us online, purchased, and we're just sort of working through that user experience.
In terms of medical oversight and risk, if people are doing this in their own homes, not synchronous with a therapist, how are you monitoring safety?
Yeah, great question. So we capture data, the subjective units of distress, and that really dictates the rest of their treatment. If they're scoring below 30, they can progress on in their treatment. If they're not, they're held there, so they can't get into an environment that's unsafe.
What's the 3.7 you're raising going to be used for?
To grow our B2B channel. So we started to get a lot of inquiries from therapists about building a dashboard, and we've built that, and so we really want to grow that B2B channel now. So onboarding psychologists who then add their clients, and either their clients can pay, so it might be a B2B2C model or B2B.
Hi, have you piloted this? Because the question I have is, have you tested it? Is it sustainable beyond 6-week window when usually people
Great question.
die off?
So in the clinical trial, the results were sustained out to 3 months and 6 months. So that clinical trial was done with the University of Otago. So we had 126 participants go through it. So those results were sustained. So we have about 60% of those people that purchased that beta product actually subscribe to that monthly subscription to get more content. Because generally, these anxieties don't go away altogether. They can creep back after a year. So the model reflects that.
How many did you say subscribed?
Well, we've had 60% of those 600 people subscribe onto that $17 per month subscription.
And how many of them use it every day or however often they're supposed to use it?
It depends on the severity. Those that are really motivated to get over it, they're using it every day for about 15 to 20 minutes. And we're seeing, as we saw in the clinical trial, a major reduction if you're using it for 15 to 20 minutes per day.
Are these all live sessions, or they are more kind of recorded programs?
They're all recorded. So another area that we're looking into is actually sort of group therapy, so a little bit more of a sort of a live session, but for right now. And that's how we can scale, is that we deliver these are all sessions that they do in the convenience of their own home at a time that suits them. And so it's a self-help program.
So what countries are your customers based in?
Like 40% in the US right now, but like I say, like we've sold into 30 countries so far, and those are all people that have found us online. You know, these disorders don't discriminate. They happen everywhere. They happen in rural areas. This technology is really well suited to rural areas because we can reach anyone everywhere with our clinically proven treatment.
Can you talk for a second about your B2B business pricing model and strategy?
Yeah, sure. So we offer a lot of value through to therapists to onboard them to the dashboard. We give them a free headset. We give them a free dashboard access. They can build hierarchies from our entire content library, which is about 1,000 environments. They then build them for their clients. Those clients can then pay. So it's a sort of a B2B2C. We use the therapists. We provide value to then get them to onboard their clients. And we're seeing it working right now. So we're just sort of testing at the moment, but that's the distribution.
Okay, a big round of applause for Adam Hutchinson. These guys are the real rock stars. You can pass that to Jenny. Okay, so you can also give her this. So if you all take a moment now, if you need a pen, we'll run a pen out to you. Adam will get it for you. And you can ask him questions if you want to. Judges especially. So, like I said, we have a whole rubric here. And it's really important to us that you guys do that. So please, if you take a moment. So when I see people looking up, that means you guys are done. So we're going to give you guys a second. Judges, are you guys done with your first round? See, what the practice judges, most of these guys have been judges here before, is they kind of score it as they're going, right? So by the time everybody looks up, everybody's done, we're good, right? Okay, so everybody's good? Anybody need more time? Fred Trotter, you need more time? Fred Trotter, data journalist, one of the OGs of healthcare. He was an OG when I didn't know anything. He's amazing. And he's also, he and his chief work together. CareSet. We didn't invest in them, but we should have. Anyway, so, Suvu, she's going to help us. So Jenny Hapgood, really amazing, really impressed. I was really impressed with Adam, too. Can we get a big round of applause for Adam? Did we do that? I mean, he's overcome so much. Okay, sorry, that's all the jokes I got. Okay, so, remember you're going to go down to 4. And we're going to play some guitars or something. It's going to be a strong signal. Okay. And then if you don't stop, I'm going to yell at you. Okay,
Saw
which
that.
is fine. Okay,
Saw that.
I mean, I like your product. I may even try it. My knee does hurt. Can I try your product?
Maybe you'll get a chance.
Okay. Okay. What if I limp? Okay. I really do have knee problems. Okay. Okay. Take it away, Jenny. That's what he starts it.
Okay. Hi, I'm Jenny. Pain kills. 76,000 Americans died of opioid overdose death last year. 1 in 4 of those were related to prescription opioids. And that's where our story starts, with 2 doctors, pain physicians from Seattle. These 2 pain doctors saw countless patients frustrated and eventually demoralized by the fact that they would do procedures, injections, medications, and the pain would not go away. They saw lives also damaged severely by opioids. So they set out on a quest to come up with a better solution. And they turned to traditional heat therapy, and they invented the Suvu pain relief system. It's for chronic, musculoskeletal, and menstrual pain. It's an FDA-registered Class 2 medical device, no prescription needed. So here's how Suvu works. With our heat wave technology, Suvu delivers thermal neuromodulation. That means waves of pulsed heat. And those waves deactivate a key pain receptor, the TRPV1 receptor, shutting off the pain signal for hours. These waves also create a wonderful soothing response that frankly makes this the most pleasant medical device you will ever come across. Our evidence. So, we've tested Suvu through multiple randomized controlled trials, which are published in peer-reviewed journals. We've tested Suvu versus placebo using the Suvu product, Suvu versus heating pad, and with these trials, we've found the pain relief comes within 5 minutes and lasts 3+ hours. We've also conducted an 8-week at-home real-world study where we sent people who had moderate to severe chronic pain home with Suvus. With that, we saw a 60% reduction in their numeric pain rating score after 8 weeks of use. We also saw statistically significant improvements in quality of life metrics, walking, mobility, sleep, and self-reported productivity. We have very high satisfaction scores, and we still have people using Suvu 2 years later to this day on a weekly basis to manage their pain. So, our commercialization pathway. Suvu is currently available to employers as a workforce pain management solution. Think about the pilots, the construction workers, the drivers, all these different people who are in safety-sensitive populations. They can't or shouldn't use medication to manage pain. They need pain relief on the job, and they can use Suvu all day long at work. So we've added in digital coaching to address the psychological aspects of chronic pain that's delivered asynchronously, and we have de-identified reporting for the employers to track progress and utilization. Suvu will become available to consumers next year. We're also launching special clinical trials to look at the use with pregnant women in 2nd and 3rd trimester. We think with our strategy, we'll hit $50 million in revenue in 2 years at a 70% margin. We have an upfront program fee for the kit, followed by a monthly subscription for those who continue to use the product. Working on Medicare reimbursement, and we will be HSA and FSA eligible. So, you can join us. You can help us reduce pain and increase possibility. Join our investment round. We're taking funding right now. We're also doing a Suvu giveaway this evening, drawing 3 complimentary systems at that URL. It's also in the QR code. And finally, you can lock in your pre-sale pricing and get a Suvu of your own. Who wouldn't want to do that?
Okay, big round of applause. Let's see. You're wearing them? Look at that. I'm wearing them now too.
Got one too.
Yeah.
All right, we'll fire it up for you.
Okay, so can you put a few more seconds back on the clock? So 3:30 is when we started goofing around. So I actually do have a real knee problem, and yes, this is a little staged, but I will tell you how it actually works. I've never tried this before, but I do believe in the science. I like science. You guys have 3 minutes and 30 seconds on the clock. Who's got questions?
I got a question.
Okay,
first of
ladies
all,
first.
I love this device. However, who's paying for this? Because how much is this going to cost per patient? And if you think about the populations you're looking at, will Medicaid or Medicare cover these costs?
Yeah,
per
so great question. Let me start with Medicare. So we would fall into basically the heating product, infrared heating product category. So just a quick search of codes for Medicare reimbursement. You're looking at products that are $800 to $900 reimbursement rates off of MSRP of $1,100, $1,200. This product, we're pricing it at $699. Pre-sale, by the way, will be at $399. So you heard that. That's your chance. So, we think we'll be able to get reimbursement fine following that pathway through infrared heat. Now, obviously in the workforce pain model, it's different. We're going after a traditional participation-based model. So $600 up front for the kit for 3-month pain relief program that includes the cognitive behavior therapy coaching. So that would be up front.
Pause the timer for a second. So I paused the timer for a second because this is just a little startup coaching. So pay no attention to this. Make your answers short. Okay, you get more questions that way.
You're right.
Okay.
All right.
Continue the timer.
Followed by a participant engagement fee that's only charged for those who are using the product. So at the end of the day, it comes out to be about half the price of what they're paying currently for MSK programs for employees.
Do you consider TENS devices as competition? Kind of where are you in that?
We do. So TENS devices are definitely competition, and TENS works differently. It kind of scrambles the nervous system a little bit and doesn't actually turn off the pain receptors. And I would also say, we have seen so many TENS patients. It's a very different experience getting electric shocks versus soothing heat.
What's the battery life?
The battery life is good for a year. And you will charge after 5 to 6 uses per day.
How long does the charge last?
Sorry, the charge will last you 5 to 6 heating sessions of 30 minutes each.
Okay.
Yeah.
How is scalability a factor with the coaching that comes with it?
So the coaching is delivered asynchronously. So we're basically doing private messaging. So coaches are able to handle, a case rate of 500 to 800 patients for back and forth messaging.
Great product. Is there a data capture strategy and how to use the information you capture?
Yes, so this is a Bluetooth connected device. So all of the data goes into the cloud, stored in AWS, and we have our reporting portal for employers as well as later for building an AI engine around it.
And can you speak to partnership strategies that you would prefer?
Yes. So, and that's really going to come in play as we get into the DTC channel. So, physical therapists, physical therapy clinics are natural partners for us. Companies that work to do drug screening would be good partners for us, where it's very important people can't be taking medication. So, we're looking for different partnership channels also into the B2B.
Do you have other business models other than the subscription-based? Can consumers buy them directly without subscribing the services, the coachings?
Right. So the other business models would be looking at our rental. And actually the rental market is most interesting when we think about Suvu for pregnancy, for pain relief during pregnancy, since that's time limited. Also post-surgery and post-injury. We actually just finished a surgery, very small pilot for people who had rib fractures, and we saw an impact on spirometry readings for the patients in the hospital.
Okay, we are out of time, folks. Love it, love it, love it. Big round of applause. I will tell you, while the applause, stay up here, Jenny. I will tell you, this thing is, this is not like somebody from the audience like set up as a shill. I really have knee problems, and this really feels good. So, great job.
Thank you.
That's fantastic.
Thank you.
Okay, so, big round of applause. Take some time to fill out your forms. You don't get to talk yet, please. So it's actually, it feels almost like a little bit like a TENS unit. It's also a little hot. I do think, just as a product review, I'm a little hirsute, so you might want to take care of that first. So, but otherwise it's fantastic. I like it. Doesn't burn at all. Okay, so I think we're ready for breathing AI. And that was a very intense, very exciting start. So this is probably we decided that this was the point in the presentation to have this. So so we got 7 minutes on the clock. Judges, you guys all ready? Timer's ready? Okay, remember going down to 4. Okay, you're going to stand back there or up there. Okay, remember to speak into the mic.
Test.
Your questions are short. I'm not going to, I only want to say things once. Okay, good. Okay, take it away. Hannes.
Hi, it's been a long day, so I'd like to invite all of you to take the deepest inhale of today. and just the letting go exhale, letting go of any stress. Who here has a lot of like dry eyes, eye strain, or neck pain when they use screen for a long time? Up to 90% of people who lose screens for over 4 hours of screen time have neck pain and dry eyes, Currently, technologies are not adaptive to us. We have to adapt to them. This leads to burnout and low engagement, which is the #1 problem of companies. Whoops. The #1 problem of companies, only less than 1 in 4 employees is engaged at work, less than 1 in 3 is thriving in their well-being, costing the global economy $7.8 trillion per year. And especially the current employee wellness programs are not working because they require additional app time, wearables, and meditation apps, even though they could be highly effective. So imagine you would get a reminder to relax your shoulders, to take a deep breath whenever you get stressed, or calming color filters to reduce eye strain, or soothing sound, bioadaptive to your vital signs. Our browser extension provides the most comprehensive and engaging wellness solution in the market, and it's a one-click activation. It easily runs integrated into your daily workflow. It's based on 7 years of pioneering XR biofeedback research we presented at Massachusetts, at MIT, Stanford, and Harvard. And we did a 3-month pilot with Ancora, a global digital health company, and showed up to 50% reduced stress symptom, 11% more focus and productivity. Right now, we have the very high engagement rates, 40 to 50%. The free version of the browser extension is in 138 countries, only word of mouth, no marketing campaign, and only 5-star reviews. We're adding the vital sign-based bioadaptive personalization using the webcam and AI as well as wearables to it. And the market is pretty large for the corporate wellness. We have very fast sales right now. We started selling in Q3, and we're mostly signing up SMBs, but we also have very large enterprises in our sales cycle. Very easy to activate, to maintain, low cost. And our current clients say we're the only product in the market that integrates into the existing screen time, and it doesn't put the burden to reduce stress on their employees. So we're B2B2C right now, but we're developing our patented machine learning technology to become a B2B with a hyper-scalable API. We're global traction with Forbes without a marketing campaign, with multiple research collaboration for NSF SBR grants. And our patent not only covers the personalization of screens, but also of audio and olfactory devices. So we are striving to become the company to bioadapt IoT, smart cars, smart homes, audio and olfactory devices to really become our best selves using screens and technologies. And I'd like to invite you to become part of our seed round. And we're a very experienced team with over 20 years of experience. And please invest in the future of AI with us.
All right, big round of applause. Okay, so if you think about it, we all spend a lot of time just sort of filling time, right? So don't do that, because every second you take away from the Q&A, they're going to ask really insightful questions that are going to help these people learn, right? Okay, enough lecturing. Judges, who wants to go first? Who has not asked the question yet? John Hui, have you asked the question yet? Okay, take it away.
How does the product work?
So it's a browser extension. You activate with one click, and then it gives you a break reminder whenever you need it, calming color filters to reduce eye strain, and soothing background sounds. So it's a very comprehensive platform. And then we're integrating the vital sign detection, so we can analyze when are you getting stressed, what's your heart rate, what's your breathing pattern, when do you need a break, when we can reduce your heart rate with color filters.
What's your secret to keep the users engaged and retain them?
Yeah, so right now, I mean, a lot of people use Flux or other solutions, but they only have an orange color filter, so it's a constantly guidance to give them a color filter to reduce eye strain. And then for break reminders, also that habit formation is really important. And then we have a gamification too, where they get reward system. And then for the background sounds, we're always adding more content. So wellness coaches, I work with Wim Hof for many years, the Iceman. So we're adding like very well-known wellness coaches, so they always get like a better product every month almost.
Hello? Oh, okay. Can you speak to your CAC? What does that look like? And also retention rates. People adopting it, using it, how long do they stay with it?
Yeah, I mean, right now we're very early stage, so it's first sales in that sense. It's just a few $1,000s. And then for engagement rates, they're pretty pretty high, up to like in 12 weeks. I think that's the most Google Analytics gives us. We're still in the like 20 to 30% range, but we're very confident that we can get that much higher, because right now a lot of people don't know when they activate a browser extension that they have to click on it one more time. So sometimes simple things, we think we can drive the engagement rates even into the first few weeks into 60, 70%, and then like getting more gamification in there, more personalization to keep that in the very high range.
Can you speak to your IP and regulatory strategy?
Yeah, so right now it's a very broad machine learning patent that's granted in the US, and we're extending it to Asia, Europe, and then we got another patent actually granted like last week or 2 weeks ago, which is not as broad as this, but it's like about like the loading time. And sorry, what was the other question? IP? Regular. So yeah, we don't require that. So we don't talk about we only talk about stress, but we don't talk about anxiety or depression. So we don't need special approval. So we can like be kind of a like B2B, B2C play at the same time without the overhead costs for regulations. And we like HIPAA and GDPR compliant. So if we use facial detection, we don't use facial recognition, but if we do vital signs, we keep it running on the device of the user, so we don't stream it to the cloud.
Similar question to that, like in your
Go ahead.
your data retention strategy, like how much patient data or user data are you retaining, and if you have a B2B strategy, what of that employees' data is going to the employer?
Yeah, we're very cautious about that. We're just keeping it on the device of the user. And right now, no employer asks us to do that. It's just like that they feel good, that they feel better. And we're only storing for cohort and Google Analytics how much it's been activated, how it's being engaged, but we just don't store those information personalized on our end. Yeah, like the trust of the user is at the core of what we're building. Sorry.
So you're asking employers to pay for this?
Yeah.
Yeah. So, because that was my exact question, wouldn't they want that data?
Right now, so far, they didn't want that data. Like, or just engagement rate, because that's what we learned. It's like engagement rate is like the #1 problem for them, because the current solutions have very low engagement rates. And so we provide that, but across the cohort, so we don't give them like personalized data on whose user is using it or not. Thank you.
Great job, Hannes. Really, really impressive. I love what you're doing. And somehow I feel a lot calmer, but it might be Suvu. I mean, it could be. So I like what you did with the presentation. I don't know if you know, but we did like 6 or 7 hours of pitch coaching with these teams, and your next team came to almost every session. Really just came a long way. Aisha McCain, really amazing entrepreneur. She won our first It's Friday pitches contest that we ran on Clubhouse during COVID. We ran them every week. I think we ran 50 contests. It was crazy. But she won the first one, and we've been working, looking, watching, hoping, coaching a little bit, and we try to bring them up to this point. And we're very excited to say she's at this point, and it's very exciting. She just won a contest, crowdfunded $51,000, sponsored by Black Girl Ventures, but lots of actual patients and regular people gave her their money because they love what she's doing. I love what she's doing too. Aisha McCain, you got 7 minutes. You know how to do this. Judges, everybody's ready? Everybody's good? Okay, I give you Aisha McCain. Take it away, babe.
Hello. Is this on? Hi. As a 14-year-old runaway from a really abusive home, I had 2 choices: sell my body or sell drugs. I sold drugs and went to prison for 5 years. When I was released from prison, I was diagnosed with stage 2 breast cancer. Hi, I'm Aisha McCain, inventor, founder, and CEO at Casual Recovery. After my second cancer diagnosis, while going through 14 surgeries, my body was on bed rest, my brain was on business, and I invented the solution for the 25% of all surgical patients that require drains. The current standard of care for a surgical drain is a safety pin. Bulbs the size of a lemon full of biological matter, a safety pin on a patient's clothing. It's really gross. People don't have to suffer that indignity anymore. I am proud to introduce the Casual Recovery Drain Management Solution to prevent complications. One drain complication costs $10,000, with U.S. healthcare spending up to $400 million treating complications. My surgeon, when he was at UCSF, he believed in this so much, he did a study that indicated that our garment actually, the patients had no complications and accelerated the healing process by allowing people to move with comfort and dignity. Our utility patent has 8 strategically located interior pockets designed to accommodate any drain, any surgical site, minimize pressure, and allow the drain bulbs to fully expand. Our pediatric garment has a superhero cape. I was looking for superheroes. I couldn't find them, so I created the young superheroes. They're pediatric superheroes to empower, encourage, and educate kids because representation matters in healthcare. My chief medical officer has identified multiple other possible uses for this particular product in hospital settings. I also have 5 other patents pending in the U.S. and internationally, including life-saving technology for asthma and EpiPens. The total serviceable market and addressable market for drain care wear is astronomical. I've built a powerhouse team of dedicated experts who strongly believe in my vision to change the standard of care. We're seeking $1.25 million in seed money to launch Casual Recovery, take this first product to market, and get us where we need to go. I would love some strategic partnerships. And thank you, Alex and MedStartr and Health and the judges and just everybody for listening.
Woo! Thank you, Aisha, for bringing that. And you can see I was modeling one of the capes. Jenny Hapgood is helping out. You can go do the catwalk, please. So, on the catwalk. Okay, so you can see if anybody wants to, try it on or see what it's like, figure out, what it's good for. So yeah, this is not part of your time because it's Alex doing his shenanigans, and I will do all the shenanigans I can think of to make you guys understand what these things are. She's been shipping me her products. They've gotten so much better. I mean, literally, the first one, I was like, really? But that was over a year ago. And these are so much better. They're great. And this is still working, I'd like to know. Judges, you guys got questions? Hey, Eugene, you got a question. So Eugene and I are part of what I call the notorious TBG, 3 bald guys, because we've been together since 2008. It's his fault. Everything you see here is his fault.
No, I lost all the hair because of you, man. Do you see the scalability of the business across new product lines, or how far can you stretch the existing product?
So I think we can stretch the existing product pretty far, but also new product lines, they're ready to go. So I would like to do some licensing of the asthma technology. But I'm focusing on the first product.
Can you speak a little bit about your sales forecast, what you've done and where you're going to be soon?
So we're just now launching, so we're ready to take orders now. So the forecast is, I believe, I have someone here on my team that's a really good question. They could speak to that better, because my brain is like, AJ, yeah. But, sorry.
Hi, I'm AJ. I'm part of the team. Aisha, do you want to talk about the total addressable market figures that you brought in?
Oh, well, I don't think she... So there's 7.25 million surgeries a year in the U.S. that require drains. So the total addressable market is that times 4 garments per patient that insurance would reimburse. I know what you're asking me. I have those numbers, and my brain is just frozen, but I could literally pull them up and show you.
Have you done any trials, and what was the feedback?
Yes, so my surgeon at UCSF did one, 30 breast reconstruction patients, and they loved it. on a Likert scale of, I think, 1 to 5. We didn't score below a 4.5 on anything, and more towards the 5s. And no complications. Those patients actually, you know, had their drains removed and healed faster because they were more active because they would leave the house. Thank you.
Are those 30 patients the only ones that have used it live?
Well, I used it live through 14 surgeries developing it, and different friends and people that have surgeries have used it live, but that's the only that have been studied.
So I know you said you wanted to get your numbers, but how much do you think you'll sell it for?
I'm thinking around $50 per garment.
And what's the margin you're expecting on that price point?
So, at that amount, like it'll be like a $30 margin.
And who would pay for it? The patients, or who would pay for it?
Insurance. And also additionally, like the private plastic surgery market, so more like elective surgeries that aren't covered by insurance, they would pay for it if they had surgeries that require drains.
Do we have any questions from the crowd? Anybody want to ask Aisha anything? Okay. No more questions? Okay. But it is the end of the day, and there's a lot of people. So I'm going to go ahead and say that Aisha has something that you can't teach. She's the scrappiest entrepreneur I've seen in a long time. So great job.
Thanks.
Big round of applause.
Thank you.
So another one of our startups just came here. Mark Rippin from HLTH is back there in the crowd. You can actually order the devices or the whatever, or get the special offers through the links that you'll see on the websites, on the direct links to buying it. So that's also part of how this changes things. Okay, so 7 minutes, go down to the 4-minute mark. Judges, you guys ready? Ready? Playing on your phone? Okay. Oh no, she's not playing on her phone. She's judging. Yeah, she's judging. Okay, take it away, Dave.
Hi everyone, I'm Dave, CEO of Aleo. Behind me is one of the world's greatest humans. Maddie used to work at Goldman in London, ran the London Marathon. Amongst her many hobbies are skydiving and wing walking. But despite all that, she goes home every night for the past 20 years and has hooked herself up to a dialysis machine. But she would never want you to call her a dialysis patient. That's because she works really hard to make sure her access stays open, her blood levels stay right. And despite all that, about 2 years ago, she was hiking up in Scotland to the top of Ben Nevis when she felt a little faint and lightheaded. And she thought it must have just been the hike. But when she went home, she unfortunately passed out and found herself in a hospital. And the reason for that was because her vascular access had failed, which had led to her potassium becoming very high, and a potentially fatal arrhythmia landed her in the hospital. And she's not the only person that struggles with that. There's 3.7 million patients on dialysis worldwide, and 37 million people here in the US who have kidney disease. It results in lots of hospital stays very frequently, and an astounding number, which is that only 1% of the Medicare population results in almost 10% of the Medicare budget. Just out of hospitalizations is $14 billion of those dollars, and 85% of them are due to these three issues, which are entirely preventable. But we just don't get the right data at the right time. And that's where we at Aleo have come in to make a non-invasive solution from a wearable to be able to get that right data at that right time. It's certainly from the payer perspective as well, and the physician and the provider and the patient, it was important to be non-invasive, have reimbursement available, and really embrace a massive shift to value-based care in this clinical condition. But beyond that, we've also seen the rise of RPM and wearables over the last decade. A plethora of devices come to every patient's home. But low compliance and not getting the right clinically actionable metrics mean you can't solve the issues that patients like Maddie are facing each day. And that's why we here at Aleo have the all-in-one solution. So just with a little patch, not only the ability to just get your basic vitals, which is already FDA clear, but being able to move past that into other arenas like hemoglobin hematocrit and a world's first to be able to do potassium non-invasively. Overall, the next 24 to 36 months, the ability to get all of your vitals and a basic metabolic panel non-invasively. What that means is something like hemoglobin hematocrit. it actually is, if you look at anemia for this patient population, that's Medicare's single largest drug purchase every single year for about $4 billion, 80% of which is wasted because we don't know when to give the patient their drug at the right time. If we look at where we can go, we can certainly not only help dialysis patients, but if you have any chronic care condition, getting the right data at the right time, which meets or exceeds this current standard of care in a scalable platform that's not afraid to go through the FDA pathway to do the right thing for patients. So if you want to join me on the path to doing better RPM for chronic care, please reach out, dave@aleo.ai.
Woo! And I just want to say, they're all rock stars.
We're going to get this right one of these days.
We're still geeks, though. No, but he actually got it done exactly in 3 minutes, and that's not easy. So great job, David. So, judges, you guys got questions for David?
Amazing progress since we've last spoken. The FDA approval, when did you get it, and are you already full commercial?
We did our first clearance Q2 of this year. We are adding on hemoglobin, hematocrit, and potassium. That's currently going under review right now. So we expect to launch into the dialysis market, given the value of those two key metrics. That's what will become available about Q1 of next year is when we expect that, and then around for both any patient population. But we already do have revenue-generating contracts with the U.S. military for what we have out there today.
Excellent product. A few things. IP. Can you talk a little bit about that? Competitor space. What are you looking at there?
Sure. So we have about 17 patents granted already and about another 24 in process. What we do differently than your Apple Watch, your Fitbit on your wrist, your Philips, your Massimo on your finger, is we don't just take an average of that capillary bed. We actually figure out a way by placing this over your radial, your brachial, your carotid, or your femoral, the ability to only look at the photons that interact with that underlying vessel. That leads to a much higher signal to noise, which means you can leverage our AI platform to get all those metrics that you saw up there. And so that's what really, I think, differentiates us from your chest-worn wearables that are getting your basic metrics and are limited just as much by location as they are by technology.
Have you spoken to potential clients? What are they thinking, and who do you partner with?
Sure. So we've got some great partners from the NHS in the UK, Intermountain Healthcare here in the US, DaVita International, all very much from a dialysis perspective. What that has meant is a massive pull into some other areas like heart failure to do initiation therapy and make sure you use the right medication for the right patient. And so we've had a lot of reach out from RPM, et cetera. So it's really trying to be able to expand the opportunity and the ability to service, quite frankly, the need. The inbound is very, very large, and we're trying to raise more money to be able to service the inbound that's here today.
Why did you build this?
So saw the patient problem firsthand. So was in medical school, was headed off to a vascular surgery residency, and just keep seeing the same patients come over and over and over again. And we knew that if we did imaging, for example, we could solve the problem. So how do you solve a sampling error problem was with sensors and software. Disappointed my very Indian parents, told them I was going to take a year off surgical residency, and here we are quite a few years later. So,
you mentioned Medicare, what's the reimbursement strategy?
So there's been a massive shift towards value-based care within dialysis. That was both the ability for patients to opt in to Medicare Advantage. So now it's almost 40% of the dialysis market, should be almost 50% later this year. That was also the HLTH, the Advancing American Kidney Health Initiative, enabled RPM to be outside of the dialysis bundle, but you have to show the ability to be able to actually tackle the key clinical metrics that matter for the patient. So both on about half the market is value-based care. Lots of hospitalizations result in about $36,000 per patient per year of those preventable hospitalizations. We can save quite a bit of that. Or there's RPM at about $250 per patient per month. That's now outside of the dialysis bundle.
How long have you been working on this? Is there a strategy for international expansion?
Indeed. So it's been about 5 years. We already have a relationship with the NHS. Because of the work that we did together, we're now part of the NHS's renal digital playbook. And then one of our other launch markets is in the GCC as well with one of the UAE's largest insurers. So we've been working both international, GCC, and the US will be the launch markets.
Hello? What's the patient experience? How long does it last? Where do they have to put it?
Yeah, so with the dialysis patient population, they typically put it over their vascular access. Already, they're required to get monthly blood draws. The NHS was sending nurses to patient homes to do this 3 times a week. So for them, not another needle, not invasive. I know where to put it because I can see it on my access. I can wear it, lasts about 3 weeks. Battery lasts 30 to 60 days, so kind of adhesive limited and getting a lot smaller our next hardware iteration.
Okay, so we let that last question go because it was a patient-focused question. But a big round of applause for Dave. Good job, man. That was excellent. Killed it. So please take a moment, do your judging. Please do not take the mic and everything away. You just leave it here. Oh, you? I believe it's Florence, but I don't know. Yes. Okay, so a little confusing back here. So everybody judged? Eugene, make sure that you... Okay. So if you are using the app, make sure you go through all the way to the end, so that the scoring gets submitted. So if you're using paper, make sure you hand it in to one of our people. They're all over the place. Rob back there with the Steve Bate will do it. He's a good person if you're going that direction. Okay, we got 2 more teams. Then we're gonna wrap this up, and then we're gonna do the prizes on stage later in the week. Very exciting. We're actually giving out real investment. We just have to make sure we look at all your data, do our final bit of due diligence, and make our deal. So without further ado, one of the most amazing teams we've seen lately, Florence from Meet Caregivers. So you know the rules. Take it away.
Great. Hi, everyone. I am Florence from Meet Caregivers, and my partner, Ivan, as well. So we are super excited to be here to introduce Meet Caregiver to all of you. So Meet Caregivers is an innovative senior care platform. Our goal is to make it easier for seniors to connect with the best caregivers that can assist them at home with daily activity, but also help them manage the care. As you all know, the population is getting older. 10,000 Americans are turning 65 every day. But what's very interesting is the fact that 90% of seniors don't want to age at home. They don't want to be moved into a nursing home nor assisted living facility. Unfortunately, as you all know, or probably already has experienced, finding a caregiver for seniors is extremely difficult, stressful. Unfortunately, I witnessed that when I was working as a caregiver myself. So many families felt overwhelmed, stressed. They didn't always know where to go to find reliable, skilled caregivers to support their loved one. This is the reason why we have built Meet Caregivers to solve this issue and support millions of seniors nationwide. Our matching system specifically match seniors with the right caregivers. Our technology take a look at 4 main factors: the care needs, but also go as far as understanding the interest, schedule, and also the personality, because the goal is to connect seniors with somebody that do not only have the skills and the training, but also the right personality to care for them and actually get along. So up to now, Meet Caregivers has been able to match thousands of seniors and then decrease caregivers turnover rate from 82% industry to less than 30%, and increase the satisfaction as well. In addition to that, we have a tracking tools that facilitate tracking coordination between the entire care team member. We are up and running right now. Meet Caregiver is growing rapidly. We are currently now in 14 states and looking to be in 30 plus states as well. What's great about Meet Caregivers is we work not only with family directly, but we also partners with institutions, health plans, employees, senior care community, so that we can support their members and provide them a full service care solution for them as well.
What differentiates us from other players, besides the matching algorithm and the care tracking tools that are built in-house, is the ability to provide different levels of care. We do not only focus on companionship. Our caregivers can provide personal care and assist our clients with activities of daily living. In addition to that, all our caregivers are W-2 employees. We are growing rapidly. We're now in 14 states, and last year we hit a 10 million revenue. Right now, we're raising Series A rounds, and we're looking to raise 15 millions in order to support our expansion and continue developing our technology.
So join us, investors, partners, so that together we can support millions of seniors to age happy and healthy at home. Thank you.
Woo! Who are you? Okay, so that's a good example of a double presentation. Nice timing. Okay, so I'm sure, judges, you guys got a ton of questions. Who wants to go first?
I'll go first.
I knew that was going to be you.
You know I got to go there. I've done home health for well over 20 years. What bothers me about this model, and perhaps you can explain it to me, who assumes the risk here? So let's say grandma picks a caregiver by your lovely app and all that. Everything goes swimmingly, and then there's an incident, an event. Who assumes that risk? Does your company assume that risk? Does the individual caregiver assume that risk? Who's doing that?
That's a great question. So with Meet Caregivers, contrary to platforms such as Care.com, we take time to really pre-screen all the caregivers that join our network, because once we match them with the seniors, they become Meet Caregiver W-2 temporarily employee. So we guarantee satisfaction and the work they provided with seniors. If there's any issue, the family can contact Meet Caregivers, and one of our care managers will be able to support them.
So you carry liability insurance?
We do. We have liability insurance, workers' comp, everything that the state requires.
Okay.
Can you talk a little bit about your business model, B2B, customer acquisition costs, retention?
Yes, our business model is pretty simple. We charge hourly rate per care. In terms of our margin is about 40%. With the health plan, for example, we are looking at doing a PMPM model and also hourly per care services as well. In terms of customer acquisition, since we have the B2C and the B2B model, most of the B2C acquisition is mostly focused on the online presence, but with the B2B model, it's more affordable due to the fact that we are partnering with health plans that are sending their members to us.
Can you comment on margins when you get to scale?
Our goal is to, in order for us to remain sustainable, is to keep the margin to about 40% if possible.
Who are your natural partners to drive success?
Yeah, so we have 45 plus senior care communities, Bright Horizon, CIEC Health. We are launching with Blue Cross in different locations. We are currently in contact and negotiating contract with Scan Health Plans, Anthem, and even United Health Plans as well. So our goal is to really work with all the major healthcare players or health plans as well.
How do you ensure you get to hire more qualified caregivers compared to your competitors, since the business is a little bit more commoditized?
Yes, another great question. So Meet Caregivers, as we mentioned earlier, our matching system definitively focus not only just on making sure that seniors are matched with the best caregivers, but we also make sure that the caregivers are matched with the right shift or position that they are looking for. So that's very attractive to the caregivers. When we onboard them into our system, we have a great understanding of their background, their personality, what's the schedule they are looking for, and how far they are looking to work, and even how much they are looking to make. So we want to make sure that the matching is working well for them as well. So those are some of the benefits that the caregivers really enjoy when they join Meet Caregivers.
Okay, that was fantastic. I love what you did there.
Thank you.
I put my sunglasses on because these are real rock stars, right? 10 million in revenue, doesn't get much better than that. So really great job. Everybody's amazing. She actually had 3 seconds left, but the thing is, I think you guys got the message. Rock star, right? Okay, we got one more, and that's also the reason to sort of hurry things along, because we all got things to do. There's a party going on over there, right? So let's get right on to it. NanoWear, bring it away, Venk. Sorry.
Venk Vardhan, co-founder and CEO of NanoWear. We're a New York-based, FDA-cleared healthcare at-home platform, combining cloth, nanotechnology, software as a service, and first-of-its-kind machine learning-based diagnostics, finally bringing healthcare to where we all are, our homes. Over 100 million Americans have been diagnosed with some complicated form of cardiology, with 30 million patients of these irreversibly regressing to the point of a procedure, implantable device, or life-altering surgery. A loved one in America dies every 34 seconds from a cardiovascular complication. The only way to sort of curb this end-stage nearing is to offer recurring cardiopulmonary assessments at home to understand the trending of these individualized regressive disease. The problem with home health platforms is that they don't offer these assessments. They're forcing their patients to go and see their cardiologist in person just to get their chest touched with a stethoscope, check their blood pressure, electrocardiograms, breaths per minute, lung capacity, hemodynamics, pulse oxygenation, activity, movement, and posture. These are decades-old diagnostic tools that are deployed at different times, different visits, by different staff, and most importantly, time synchronously aren't talking to the same back-end data system. NanoWare, we asked ourselves, what if we could combine all 7 of these first-line diagnostic tools into a single device-enabled platform that offers a substitute for these cardiopulmonary assessments to be done at home? And what if that same platform can go to the last and most important mile, which is triaging individualized cardiopulmonary risk while the patient's at home? That's the goal of remote diagnostics. We accomplished this just 9 months ago, launching our SimpleSense platform in the US. Here, the patient, via prescription, gets a gender-neutral, size-adjustable shoulder sash, wears it for 45 minutes, sending and providing a full cardiopulmonary workup and summarized data trending to their physician digitally in real time. Don't take our word for it on efficacy. We point to our multiple FDA clearances and our Tier 1 peer-reviewed publications that have reviewed the comparative data against multiple gold standard devices. We give our device away for free and charge a data services ARR model per patient per month, selling into cardiology-based OEMs, therapeutic providers, and CRO channels that serve these channels. We've got over 1,000 patients on the platform in just 9 months. We're consequently raising a $20 million Series B round to scale that traction and accelerate the growth. Very operationally and financially efficient. The market's the only sort of company in town that has a cloth nanotechnology and these machine learning based diagnostics differentiating. But we've also scaled our production here in the States, as well as have a very valuable IP portfolio of 11 awarded patents, 13 pending. Couldn't have done this without the best team in the world. We really just get the right talent from the right places. Beyond cardiology, $100 billion market, lots of different places we could go. Precision medicine, adaptive clinical studies, not just decentralized clinical studies, military, industrial safety.
Meg, I know your deck. You got like another 2 minutes here. Wrap it up in 15 seconds, please.
Right at the end, biggest reason we probably built the company is to really serve the underserved community, really singularly driving the biggest cost of our healthcare system. We want to bring healthcare to their homes as well. We're NanoWare. We bring smarter care anywhere. Thank you, MedStartr. Thank you, Health 2022.
Woo! I love what they're doing. One of the most amazing companies I've seen. Doing it for the right reasons, too. Okay, judges, I'm sure you guys have a lot of questions. Judges, anyone?
Can you tell us more about the device? So you say you're giving it for free. Maybe can you share the cost? And how long does it last? Do you have to change it every so often?
So the patient wears it for 45 minutes. We don't see a use case for longer than that, just given the data trends and the studies. The shelf life is 360 hours. So if a cardiologist needed a really sick class 4 patient to wear it for 1 hour per day, it would basically be a year of shelf life. That's what we have on file with FDA. To answer your question on the device for free, basically once a patient uses this about 10 times, the amortized COGS of the device basically go to 0. So we can charge a per patient per month data services ARR model. We're not really targeting any use cases that aren't on the platform for more than 12 months.
Amazing technology. Can you talk a little bit about your partnership strategy and who you're going after with first, and what are they saying?
Yeah, so our first partner is a multi-billion-dollar publicly traded OEM in the space. We have one other LOI in structural cardiology, a publicly traded $10 billion plus company that we'll hopefully be able to announce by the end of the year, and 2 device-focused CROs we're expecting to convert into contract from LOI in the next 2 months.
Can you talk a little bit about the customer experience, utilization, drop-off? What happens there?
Yeah, great question. On a 309-patient hypertension study, we had 91% compliance in use. 97% compliance in patients that would want to do this in a clinical study at home as opposed to driving 50 miles once every 3 months, 6 months. That's where we can really drive the initial value, Paulo, is that, you know, these decentralized studies, they really need to be adaptive studies. And if you can't get out to the community centers and just do studies at Mayo Clinic, you're really going to miss all the data that FDA really needs for these digital products.
Can you talk about your business models? The reason patients are still going to physician offices is because that's how the payer models is built upon. So how do you get physician support to use something that may cannibalize their potential revenues?
Yeah, it's a great question. I'm going to answer it in twofold. I'm going to answer the latter part of your question first. We're starting on a B2B with OEMs, CROs, and therapeutic sponsors. The reason is that they'll pay us per patient per month to get that data-driven insight from phase 2A all the way to a phase 4 registry study. That's going to be super important, not only for them providing it to data to the payers, but for us to sort of absolve ourselves from that valley of death typically. But once that's actually done in sort of pushing it, it's not like we're going to Mayo Clinic or Cleveland Clinic and saying, hey, we're gonna cannibalize you, the cardiologist there. This is really mostly for the rural communities and the community centers. They don't have the staff to support their outpatient clinics anymore. The preoperative and postoperative consults aren't where they're making money. They make their money on the procedure. And so it's not really a choice for them anymore, sadly. It's really an issue of need. And we're the first to admit we got lucky with the pandemic kind of pushing that.
I was just curious, you got cut off a little bit at the end on your mission about the underserved populations in rural. Can you give us a little bit more information around, you know, uninsured individuals, Medicare, Medicaid? How are they getting coverage for it? How are they getting access?
Yeah, so again, sort of a phase 2 of us, once we have enough data to prove the value-based care programs. Ultimately, once we're at sort of units of 10,000 in production to 50,000, our COGS get immensely cheaper from production. So we would love to be able to give this at a very, very reduced cost. Because right now our margins are at the 95, 96% margins.
Okay, big round of applause for Venk. Good job. I love what you're doing, man. So that's it for this contest. We do have, I don't know exactly what it's going to be. They haven't told me yet. But we're going to do the prize, and we're actually going to be handing out actual investments. So we're going to close our deals in the next day or two. A lot of it's going to be based upon what you guys put on those cards, and what you put on those forms, what you put in the app. So please take a moment. You'll see anybody who works with MedStartr, our teams, please hand in to those people like Rob DeLeonardis back there. Raise your hand. Anybody who can accept forms, or just bring them to me. So I want to thank all these people. Pat Hurd made all these just amazing things, especially the AV team right over here. Andres, Chase, putting up with all our craziness. Thank all of you, because without your input, it would just be us deciding, and that's not good enough. So I also want to bring up, there's an after event later tonight, which Nick Atkins is hosting. So that's here. So join us at Double Down. Meet all teams. Let's go deeper. And this is also part of the process. So I just want to thank everybody for coming. You guys are awesome. And also I want to bring up all of our portfolio teams, all the people that won our contests. And we're going to just play a little music on the way out. Have a great night. Drive safe. Enjoy the party. If you have questions, you want to invest in the fund, feel free to come up. If you like any of these companies. But do not forget to turn in your forms. If you've got paper forms, I'll take them up here. All the teams, come on up. John Hui from Triage, CareSet, all the winners. Thank you. What'd you think?
But committed no crime.